Hello and good morning and welcome everybody to our webinar today on cognitive aging and boosting brain health in older adults and what future health professionals should know. I will be your host today, Emma Evans. Today we are joined with some of the world's most professional and well-known people on the topic of cognitive development. First, we have Dr. Caleb Jolly, who has specialized in cognitive decline and normal cognitive changes among an aging population. We also have Dr. Eric Mesa, who has done his research in brain health and different brain programs that are available to that population. And finally, we have Dr. Julia Tatioka, who will be our expert on healthcare and gerontology today. As we go throughout this webinar today, we just want you to be aware of this quote and keep this in your mind and in your heart today, that life is not merely being alive, but being well. Kind of the format for what we're going on today is we're going to go through normal cognitive changes, and each of our professionals will be talking to us today. We first did a little survey of the population at Brigham Young University to see what they knew about cognitive health and preventative measures. 1 in 9 adults actually experience subjective cognitive decline in their life, with a higher prevalence in men than women. And so it's something that's really prevalent in our population. We want to see how much BYU students know about that. We see that there's a lot of knowledge about nutritional things, nutritional aspects of brain health, but we see a wide variety of answers to, what activities students do to promote brain health, as well as hours of sleep. And as we go throughout our webinar, our experts will talk to us today about why that's so important to us. We will first be turning the time over to Dr. Caleb Jolly. How are you doing today?
I'm good, Emma. It's good to be here. Well, like Emma said, I'm going to be I focus a lot of my background and research on cognitive changes that occur with ages. And here listed on the slide are 6 different changes that are fairly common, and you may even have noticed them in someone that you know who has changed cognitively throughout their life with age. A couple to note here that are important are just processing speed slows and selected and divided attention decline, as well as a few of the memory aspects of cognitive decline. It's important to note that a lot of cognitive decline occurs in the neurons in our brain as they lose a lot of their function and ability to communicate with other neurons and communicate messages throughout our brain. I guess going on to the next slide as well, you may notice or have noticed in loved ones or other grandparents or friends who are older, these normal cognitive decline signs, like becoming more impulsive or forgetting appointments, or feeling increasingly overwhelmed by making decisions and plans. And just like I was saying, a lot of that just ties back to how our brain ages over time as well. So when we're born, it has complete function and is able to develop very rapidly. But as we become older, the signaling highways and transport systems within our brain begin to decline and to deteriorate to the point where we lose some of those functions by those neurons in our brain. And that's what I've been able to focus most of my research on.
Thank you so much. I think that it's really important for people to know the difference between the normal brain functions that happen and the decline that happens naturally as we age, and then those worrying signs that could be a caveat for something more serious in the future. Next, we'll hear from Dr. Mesa. How are you doing today?
I'm good. Thanks for having me here. So I want to talk about boosting brain health, and it's all about stimulating the neurons. So perhaps one of the most critical things that we can do, and anyone of any age actually should be doing these things, is to prevent cognitive impairment, or these 6 things right here on this slide. So First and foremost, physical activity, then sleep. Make sure you're getting the proper amount of sleep, and that depends per person. As we age in different stages of life, we need different amounts of sleep. Nutrition, and it's all about eating intuitively and staying healthy. And then brain stimulation, things like puzzles, things that stimulate the mind. And interestingly, music has been proven to have large amounts of benefit for boosting brain health. And lastly, conversation, socialization, also very key to helping those neurons stimulate. So part of the brain stimulation, 3 aspects of it are first the brain game. So things like trivia, Sudoku, arts and crafts, word puzzles, reading fiction books, any kind of puzzle really, any of those activities that really stretch the mind, and get the person thinking. It helps those neurons activate and keep going. And the more you do that, the healthier your brain will stay. And next up is music. And that has been scientifically proven to be effective in combating the deterioration of brain stimulation, of brain health. So that includes learning music, reading music, listening, dancing. Music can reduce blood pressure, anxiety, and pain, improve sleep, mood, memory, and mental awareness. So everything good, music is great. Last thing is socialization. People need to be around other people. Relationships are important. Here it says building social networks and participating in social activities are like exercises for your brain because they keep your mind agile and improve cognitive function. It's been proven that they decrease depression, anxiety, lower stress levels, improve your satisfaction in life. You're happy when you're around other people. Socialization has also been proven to lower the risks of dementia and Alzheimer's and other diseases. And there are several programs that help combat and help people stimulate their brain. So these include Us Against Alzheimer's, Healthy Brain Initiative, the Alzheimer's Disease and Healthy Aging Program, and the Brain Health Project. These programs are made to provide awareness, prevention methods, and treatment of all of these brain diseases.
That's great. Thank you so much, Eric. I think that it's important that you said that, to remember that the next time that you are visiting someone that's elderly or one of your grandparents, to remember that you're helping them with their cognitive state. You're helping them get their workout in. Next, we'll hear from Dr. Tatioka about healthcare and gerontology. And so, Dr. Tatioka, what's been going on in healthcare to help with this population?
Yeah, thanks, Emma. So a lot of course, healthcare is preventative, especially with cognitive decline. So you need to take those steps early. But some assessments healthcare providers give their patients are just a list of these 4 common ones. There are more, but the mini mental state examination, that's a 30-point examination where they ask you things like what's the day's date, or what city and state are we in, things like that, to know where you are. If you get a score of less than 24, that usually indicates that you have some type of dementia, either mild. I mean, the worse the score gets, the more severe the dementia gets. The Montreal Cognitive Assessment is similar. This one will actually have you, if you've heard of drawing out a clock, that's this test as well. The standardized mini mental state examination is almost the same as the mini mental state examination, with this one being a little bit more easier, I guess, where there's more standardized points. And the abbreviated mental test, this one will just help you. It's a score out of 10. Anything under 6 will indicate that you probably have some type of dementia or mental or cognitive impairment. And so here's this little video that I found that healthcare providers in the UK are doing right now. So let me make sure that I'm sharing my sound as well.
Over 4 years, 102 healthcare staff, including nurses, doctors, GPs, paramedics, community health carers and hospice nurses, joined the fellowship. And through listening to each other and developing bold ideas, they succeeded in creating better dementia care. To help our newly developed Dementia Fellows keep connected and spur each other on, in 2018 we launched our second initiative, the Dementia Care Improvement Network. Alongside a quarterly newsletter to share research evidence and network events and webinars keeping up the good practice circle, we also developed the Dragon's Den, where teams could pitch ideas and compete for startup funding. 9 original projects have been funded, including an initiative to connect isolated people in rural areas, making music with people living with dementia, using remote new technology to reduce hospital admissions, and an advanced care planning toolkit to support end-of-life care. The final year of the network.
And that video is just one way healthcare providers are helping those with dementia who already have dementia engage their brains and help keep the brain that they have even more active. All right. And just some other things healthcare providers should know is the care of the caregivers, the way they are taking care of their patients, educating them, making sure there's no abuse. Other healthcare administrators and providers are researching the disease and emphasizing that caregivers should have a good mental and physical health so they can give the best care. But of course, the best treatment is prevention as early as possible. So thanks.
Thank you so much, Dr. Tatioka. So I think that we have time now for a bit of a Q&A that are coming into the chat. Our first question is from Rebecca Stafford to Dr. Tatioka saying, in your opinion, what is one thing that people can do or be a part of in raising awareness about cognitive health among an older population?
Yeah, people can really just educate themselves individually, but also as a community, we could maybe provide billboards or flyers that could advertise knowing about dementia and Alzheimer's really, and how we can best help those around us with the disease.
Excellent, thank you. Our next question comes from Jonathan Dollahite to Dr. Mesa saying, I have a grandmother who is starting to lose it, quote unquote. What can she do to stay cognitively fit?
Good question. So one of the things that you can do, especially if you love your grandmother, is provide that socialization for her. So you should visit her, give her calls, make sure she's taken care of in that way. And you can also combine other things. You can go exercise with her. You can go on walks with her. You can do puzzles with her, stimulate the brain. Any activity like that, just making sure she stays social and keeps doing those brain stimulating activities are important.
I think that's a great note for all of us, for our grandmothers. Our final question is to Dr. Jolly from Robert Smith. It says, I have a fear of dementia and cognitive decline. What can I do in my youth in terms of preventative care?
Well, Robert, that's a great question. Thanks, Emma, for the question there as well. But I agree a lot with what Dr. Mesa talked about earlier about the importance of sleep. A lot of dementia and other diseases related to memory loss don't happen in one moment, but they're a result of changes physiologically over time for a large amount of period. So getting sleep allows your neural pathways to continue to regenerate and to rest and have that time to be rejuvenated each day. So I would say sleep is probably one of the most important things that youth and honestly anyone from any age category can do to continue to remain cognitively sharp.
Thank you so much. Seems like we're running out of time, but thank you everybody for participating today, and have a great afternoon. And we have a quiz if you guys want to check your cognitive abilities. Okay, bye-bye.